Before we explain the prognosis and possible outcomes of the chronic lymphocytic leukemia, it is important to understand what leukemia is at all. When you're diagnosed with some serious condition such as leukemia, it is really important to understand what that is and what to expect. And that is often not the case because doctors simply don't have enough of time to talk to their patients and explain everything in details. This here is a bone, supposedly. I know it's not a great representation of a bone, not a perfect illustration, but let's assume it is a bone. Well, this over here, inside of that bone, is the bone marrow. And that spongy tissue is the place where blood cells are created. And that is exactly where this cancer is located at. Leukemia is a cancer that involves bone marrow, and problems and consequences of this cancer can be seen in the peripheral blood. As we said, that is the place where blood is created. Obviously, if there is a cancer here in the creation of the blood cells, well, we should be able to tell that something is wrong by just analyzing blood, the peripheral blood, in their lab results. This over here is a monoclonal B-cell lymphocyte. And that what we can see here on the surface of this cell are the membrane proteins. These membrane proteins help us diagnose this condition. These proteins are marked by numbers such as CD20 or CD20-19 plus or CD23 plus, as well as CD5 plus. And while simply analyzing the lab results can help us see that there's something wrong, these proteins can actually help us pinpoint the condition that is causing the issues and the symptoms. These proteins on the surface of the cell membranes can be identified using a method called flow cytometry. And that way we can really not only see how many lymphocytes they are, but also what kind of lymphocytes are present. This is an incredible source of information that help us diagnose chronic lymphocytic leukemia, but early treatment does not really help one live longer. In fact, in this condition, it is slightly different. First and foremost, we should cause no harm to the patient. And I'm going to repeat that, no harm to the patient. And excessive therapy without true need for it can indeed cause more damage than help. Normally, we should also care about the quality of life of the patient. And it is important how the patient is feeling and his well-being. Therefore, applying a therapy in this case should be considered if certain criteria is fulfilled. Because if we know that the therapy will cause more damage than help, we should not apply it, of course. One such criteria is a decrease of hemoglobin below 10 grams per deciliter, and a decrease of thrombocytes count below 100,000 units per microliter. This is a clear indication that the therapy should start. There are other indications when these therapies should start. Even when we decide to start a therapy, we have to understand the patient and the patient's condition. A sick patient can survive a much more aggressive therapy than a patient who's old and fragile and already has other diseases. So we can learn today that starting a therapy and also what kind of therapy are decisions that can be made first and foremost with good diagnostics and very professional interpretation of these diagnostics. An answer about what kind of therapy and when the therapy should start almost always requires a second opinion, so that we make sure we do not actually damage and harm the patient that is already suffering. That can really and unfortunately happen, and it does happen. If you have more questions about chronic lymphocytic leukemia, then go to Symptomsky.com help CLL. But if you're a doctor and you want to make videos like these, then go to Anatomsky.com. And both of you can actually subscribe to this channel and help us reach more people who suffer or assume they suffer from chronic lymphocytic leukemia.